Good morning and welcome. I am Dr. Victoria Mazes, and I'm the Executive Director of the University of Arizona Center for Integrative Medicine. And I'm so glad that you are all here. A special welcome to the staff of the Center for Integrative Medicine and also to the people who are watching AZPM on live stream. And to my right is Dr. Michael Dake, who is the Vice President of the UA Health Sciences, Dr. Andrew Weil, Director and Founder of the Center for Integrative Medicine, and Dr. Robert Robbins, who is the President of the University of Arizona. And today we're here for an incredibly exciting announcement. And Bobby, would you do the honors?
Well, good morning, everyone, and thank you for being here. I'm a lot louder than you. I don't know what just happened, but thank you. I'm here to share with you all a very exciting day and some very exciting news that Dr. Andy Weil has made a new commitment to the University of Arizona of $15 million, and that represents over $20 million commitment that Andy has given back to this incredible university. So Andy, thank you so much.
So Andy, is there something you want to say
about
this amazing gift?
I'm very happy. This is a wonderful day. It's been long in coming. And, you know, I've been working at this for really most of my life, probably over 40 years. I first wrote out the philosophy of integrative medicine quite a long time ago in a book called Health and Healing. And the center, we've been 25 years in existence, the Center for Integrative Medicine. We have been self-sustaining through all of that time. I think one of the few institutions at the university that has been self-sustaining. We haven't gotten state money. We've been self-sustaining through tuition. We've become the world leader in integrative medicine education. And for a long time, we've wanted to have a home and financial stability. And when Bobby Robbins, just before he assumed the office of president, he asked to have dinner with me, said he had been a longtime fan, and he couldn't understand why the university had never seen what it had in the Center for Integrative Medicine. And he said he was committed to making this a top priority. So thank you very much for doing that.
Thank you.
Yeah.
As many of you have heard me say, I firmly believe that integrative medicine is the way of the future. Through its emphasis on lifestyle modification and bringing in less expensive natural therapies to mainstream medicine. I very much believe we can lower healthcare costs and improve outcomes. I feel confident that one day we'll be able to drop the word integrative. This will just be good medicine. And also, I'm very happy to announce that in partnership with Banner Health, we will be opening an integrative primary care clinic here in Tucson, probably early in 2020. And we believe we have a model that will be sustainable, profitable, replicable. And if we can demonstrate, as we think we can, that integrative medicine produces better outcomes at lower cost than conventional medicine for the management of common health conditions, I think Banner will be enthusiastic about replicating this throughout its system, and eventually this could be a new model for healthcare in the country. We've got all these 1,800 graduates of our fellowship who would love to work in such places. So I think this is the way of the future.
I agree.
Thank you. So Michael, as VP of Health Sciences, what do you think the importance of having this center at the UA?
Well, obviously Andy's been a change maker, I was going to say for 3 decades, 4 decades. But I think today's announcement certainly cements his legacy and the commitment to integrative medicine at the University of Arizona. And we're in this beautiful facility. Actually, I think it's on about the 3rd event we've held in here. And this is the Health Science Innovations Building. And I think it provides a type of environments that I think are vibrant and synergistic to the future of how we can train people in integrative medicine. And so we look forward to having trainees in integrative medicine, participate in interprofessional education here, which I think is clearly the wave of the future, and Andy was ahead of that wave for a long time.
And I'd like to acknowledge Dr. Jim Dolan, who is sitting in the front row. He was the longtime dean of the College of Medicine. I approached him early in his tenure here with the idea of, well, I wanted to create a residency. I said in integrative medicine. He said, you can't really start a residency in a field that doesn't exist. And he suggested backing up a step and designing a fellowship. He said that way you wouldn't be accused of tampering with the unformed minds of young physicians. And he was the first medical school dean to go out on a limb and support this, and he took a lot of flack for that as he traveled around the country. Thank you, Jim. Another thing I want to say is that we have, over the past, since we've been in existence, have had visitors from all over the world come to see our center. And it's very embarrassing for them to come to this little shabby house on Mabel, and they say, this is the Center for Integrative Medicine we've heard so much about. I was once at a meeting on integrative medicine in Cairo. I was one of 3 Americans there. It was about 10 years ago. And one of the speakers was a woman who was the Minister of Health of Malaysia. And when she was introduced to me, she said, oh, everyone knows about the University of Arizona Center for Integrative Medicine. So we have this reputation, and now I look forward to having the physical presence here as well.
Absolutely.
So Bobby, I understand that even before you became president, you asked to have a meeting with Dr. Weil. What intrigued you about integrative medicine or meeting Dr. Weil?
Well, as Andy rightfully said, we met even before I started. And I just wanted to meet him because I'd read all of his books, and you know, I relayed the story about how the unfortunately failed, or maybe fortunately failed, merger with UCSF, Stanford, occurred. And on the Stanford side, I had become involved with David Spiegel and others who were disciples of Andy's to think about how we could go in an integrated approach to helping our patients with cardiovascular disease. And I think that, you know, all of what Andy has really thought of and built upon over the years, you know, you should eat the right foods, you should exercise, you should not smoke, you should drink just enough, and the right kind of red wine. Gives me a headache, so I can't do it. You should get enough sleep, you should manage stress. If we could do all of those things, as I've said many times, the most important gene yet to be discovered is the compliance gene. We know all these things, but we're people. And, you know, I continue to drink Diet Coke, and I know I shouldn't, but I'm working on that. Occasionally I take a respite from it. But I just wanted to meet him. And I wanted to, like the Minister of Health from Malaysia, who I actually know from past life, I wanted to come see this great center of where does it all flow from? And when I learned that there was no big center, I mean, the center, of course, is the spirit and it's the program. Buildings are nice. This is a beautiful building, and you know, it's important, but it's the people, it's the programs, it's the thought. And we're truly sitting in the presence of Andy, who started this whole field, started people to think about this could be the future. And I believe, even though cardiovascular disease continues to be the #1 killer, right there with cancer, we always had debates with Ron DePino in Houston about, well, the reason cardiovascular disease continues to be the #1 killer is because they've made so much progress in cancer. And I think we'll continue to make progress with immunotherapies and things that, you know, could potentially have cancer resulting in a chronic disease. And, you know, all the cancers are really individual cancers and all those things. But in the long run, we're going to live longer, but we need to have quality of life. And I think if we all follow the guidance of our sage leader here, we'll end up living longer, healthier lives, that will be more productive and more fulfilling. So I wanted to meet Andy, and just to, I heard Ben Carson say one time that he was sort of people knew he wanted to be, quote, a psychiatrist in undergrad, so people would come to him and sit at his feet like little children. I just wanted to sit at Andy's feet and finally get to meet him. And we did discuss at that first dinner. I was very intimidated about what was I going to order, and I watched and said, what's Andy going to eat, right? And I probably got a steak, but to have the University of Arizona be the epicenter for this movement around the world. Andy, thank you for choosing this as your home. You can tell the story of how it was that it was Tucson, but we have derived incredible benefits as a university from having this notoriety, but most importantly, to be able to serve patients all over the world. And I think Andy's right. When I was doing heart surgery, it's great to treat one patient at a time, but when you train others to go out all over the world, you can go to any city, any region of the world, and you'll find one of your fellows. And you know that they're evangelizing your message all over the world, and it came from the University of Arizona. So it is, in my opinion, 20 or 30 years late in coming, but at least you're still here. And as I told Coach Candrea the other night when we opened the new softball stadium, it's really nice. It's got shade, so that's good for people who really love softball. But I said, I hope it keeps him around another 10 or 15 years and extends his career. So I hope the same thing for you, that this will be not only validation, because you don't need validation, but a celebration of your life's work. And having Victoria and the whole team, Esther, that you've built, we just couldn't be more proud and pleased and happy that we can finally get the program to where it needs to be.
Thank you so much. Wonderful to hear that from the president of the University of Arizona. And by the way, you can have your occasional steak, but I'm going to talk to you about the Diet Coke.
Yeah, Diet Coke's worse than the steak. Cut way back on those things.
I quoted Dr. Denton Cooley, I think in the book Health and Healing. I talked about how little effort was spent in medicine on prevention. And he has, although I admire him greatly, he said that your cardiovascular destiny, 98% of your cardiovascular destiny is determined at the moment of conception. And if you want to waste time on the other 2% by attending to lifestyle, that's up to you.
Yeah, he was off.
He was off.
He was off, yeah.
Yes, way off.
He obviously I knew him very well, and he operated on over 100,000 people in his career, probably one of the foremost cardiac surgeons. But we focused on, it's always better. 100 years from now, we'll look back and we'll look at taking a saw and sawing someone's sternum open and think, what in the world were we doing? It's much better to prevent these things. Some things you can't, obviously, around lifestyle, whether it's congenital heart disease or maybe it's what the mother is eating in her lifestyle could have even outcomes on congenital heart disease. But we looked at programs around, just imagine the stress that you have of being told your artery's blocked, you're going to have to go see Dr. Crone, and he's going to cut your sternum open and give you a nice bypass surgery. Managing the stress in terms of using self-hypnosis or mindfulness or touch therapy or whatever, wouldn't it be better to do that on the front end so you don't have to go see Dr. Crone? Even though he's a great heart surgeon, you just as soon wouldn't have your sternum split. So if we followed the teachings of Sir Andrew, then we're going to knight you today too. You didn't know that.
I think you might decide you should do our fellowship in integrative medicine.
I want to do that.
Can I tell a couple
Please.
So I've been here only 9 months, as
Yeah.
you know, but I met you within the first
Right.
month, and we sat in an office when we were thinking about all of this, and you gave me a book that you had signed, and actually you said you'd give me a book. The book came over, it was in my office. People would come to my office, and we'd tell them, and I'd start to talk about Andy Weil, and they'd go, their mouth, Andy Weil. I said, well, I've got a book that he signed. Oh, could I have? You know, so I embarrassingly.
They always want to steal it from
They
you.
always want to steal it. And so I asked embarrassing, could I have another book? And another book came. Same thing happened again. And so when I was in that meeting, this number of fellows came up in integrative medicine, 1,800. And I thought I didn't hear that correctly. I thought I was a mistake. But I want to thank so much you. This is a treasure. And Dr. Dahlin, too. Last week, I was at a lunch with Mel Zuckerman. And Mel Zuckerman did not know that this, he wasn't aware, he's 90 years of age, that this was happening today. And when he found out, the biggest beam, you should know, on his face, he said, oh, you must tell Andy congratulations. I'm so proud of this. And he told me the story of how you came to the, of course, you maybe took more credit than whatever, but he was saying, I kept telling Andy, it's not going to work unless you go to the university. You've got to get into the university. You'll be out there, in the, wandering in the,
right.
yeah. So.
And Victoria, you made me very happy a few months ago when you told me that we had a waiting list for our fellowship for the first time. So it is gaining more and more of a reputation.
And I think you should mention, besides the fellowship, the integrative medicine in residency and that impact.
Let me say that when our program started, we had a residential fellowship. So we had people here for 2 years, and we took 4 fellows at a time. And the main criticism that I got all the time was, how possibly are you going to change anything in medicine by training 4 people a year? But there was method in what we were doing. First of all, over the years that residential fellowship existed, we graduated about 35 people from it, and many of them are now in influential positions. They direct centers at other universities, they've written textbooks and so forth. But more importantly, it gave us a chance to develop a really solid curriculum that we could translate into a distributed learning format and reach many more people. So then we started our online fellowship with residential weeks here. That's the one that I think it's probably the largest fellowship in the world. We train something like 160 people a year in it. But then we want to reach even farther than that. So we decided to develop a condensed curriculum of 200 hours, mostly, to be embedded in residency training. And that's where we feel we can make the greatest difference. I don't think it's worth trying to worry about undergraduate medical education. The curriculum is too stuffed and people forget all that by the time they're in residency. But residency is where attitudes and practice habits are formed. So this curriculum, which is a required accredited part of residency training, is now in how many programs?
74.
74 programs around the country, in Canada, also in Taiwan and Germany. Started in family medicine, then in pediatrics and in rehab medicine.
Internal medicine, psychiatry,
medicine.
OBGYN.
And our goal is to have this be a required accredited part of all residency training in all fields.
Yes.
I think that's a very realistic goal. So one day, whether you go to a psychiatrist or a gastroenterologist or a dermatologist,
or even surgery.
That physician will have basic training in nutrition, in botanical medicine, and mind-body interactions, and all the things that are left out of conventional medical education. I think it's a very realistic goal.
So we have some folks in the audience who may have some questions. There are mics that can be used, and there'll be people walking around with a mic if you have a question you'd like to ask one of the panelists.
Could I just
Please,
make one other?
Of course.
I'm going out on a limb here to maybe disagree a little bit with Andy, and I understand he can't do it all himself. But out that door, if you look to the west, there is a beautiful honors village that's coming out of the ground, which will will have the first students occupy this fall. And one of the selling features, of course, is they could walk right out the front door to Eller College of Management, or they could walk down the street a little bit to the law school, or they could find their way down to the health sciences. And we don't know exactly where your building is going to be, but my hope is they're going to walk into your center and say, I want to learn about this, because that's the time to get them. And to, we have 35,000 undergrads a year at the University of Arizona. And as we go through and think about how we're revitalizing our general education program, I keep saying to people, well, there's got to be financial competency, there's got to be cultural competency, there's got to be medical competency. How do all these people learn about, well, they go to the internet. Well, they could walk down the street and learn directly. May not be the two of you doing the teaching, but I hope this permeates even into the graduate curriculum.
Thank you. So I'm looking around to see if anyone has questions.
We know a lot of you. We can call on you.
So if not, Andy, you want to say something in closing about this gift that you're making?
It makes me very happy to be able to do it, and I hope it will stimulate, as I said, other giving, and that it'll really establish the University of Arizona as the place to learn about integrative medicine.
Yes.
Well, thank you, Andy. Michael, you want to say anything?
Well, it's just a great day, and again, this is something that we're really looking forward to working with you to develop this to even a higher level.
Well, I guess I would say, number one, again, Andy, thank you so much. Not only just for this gift, I think that's obviously transformational, but just for making a bet and choosing the University of Arizona to do your life's work. I know you go all over the world, but you always come home to the University of Arizona, and we will always be known as the birthplace for this movement. Are there any things other than what I talked about in terms of eating and exercise, any tidbits that you're going to give us today that, the latest thing?
You know, in my work with patients over the years, I am more and more convinced that the mind plays an enormous role in outcomes and attitudes. And I have had so many patients over the years who've come back to me and said, the most valuable thing you did for me was that you were the only physician who ever told me I could get better.
Yep.
That makes me very sad in a way. But, I genuinely believe that because I've seen that in myself and I've seen that in other people. And I think to be able to give that message, if you really understand the human body's potential for healing and all the mechanisms it has for correcting itself and maintaining equilibrium, that's one of the most valuable things that a doctor can do.
Yeah, and I think it's so integrally connected to all of the body, obviously, but certainly the immune system. And as we're learning more about how important the immune system is, it's going to be valuable. So I wanted everybody to get at least the tip of the day. So that's
Take home.
Well, thank you, everyone, for coming. Thank you, Dr. Weil, Dr. Robbins, Dr. Dake. And thank you so much for your long-standing support of integrative medicine. We got to keep going. Thank you.
This is good. If you have time sometime, let's get together for dinner. Okay, good. Yeah, that'd be great.
Thanks, Sam.
Good, sure.